So thank you so much for the three of you and your eloquent insights. It helps make real what we've been talking about all morning. I think we do have time. We're a little over time, but if you're willing, if we could have one question, we have time for that.
Good afternoon. Excellent panel. I'm Cameron Ritchie. I'm a retired Army psychiatrist. I now work for Washington, D.C., and I teach the police on how to deal with mentally ill individuals. And I know the criminal justice portion is tomorrow, but while we've got you up here, Eric, you mentioned a little bit about what the police would know. If you could just briefly say, what should we be teaching the police on dealing with mentally ill youth specifically? You mentioned resources to refer them to. There's a lot of concern by the police about autism and working with people with autism. Any insight and elaboration about what more we should be teaching? And in this case, it's the Metropolitan Police Department mainly here, so right here in Washington, D.C.
We just recently actually at SAMHSA had a juvenile justice dialogue discussion meeting where we brought in stakeholders from the juvenile justice, criminal justice system, and young people with lived experience in those systems as well too, and had a conversation around that. That's where the suggestion around the having an application for police officers about where young people can go when they do come into contact with police in any hour of the night. I think, and there are some resources around this too that have been developed about how police officers can respond to young people and identify whether they're in a mental health crisis or not. And so it's incredibly important. I mean, I was a part of a crisis response team when I worked for an organization called Youth Villages, and we had a young 11-year-old boy, just in a very crisis state, and the police were called, and I had to watch this 11-year-old get put in handcuffs and get taken off, and it was just like that. I knew that was not the appropriate way to respond to that situation, but because there was literally nowhere else to take him, it was either there or the hospital. Like that's the route that it went. And so it's about training police officers within their communities about where they can take young people, where are the resources that are available, who are the right people they can call to get them linked up with services, so that this trend of cycling through the system doesn't continue.
Thank you everyone for being patient and going through.